It is 12:30, and good afternoon to you, Brian Does. How you doing today?
Hey, we're doing good. I was just thinking, we had Marty with the Six String Summit in yesterday.
Yeah.
I was playing a little spot there. Maybe someone needs to host the Pelvic Health Summit for all America here.
All American.
Yeah.
In the heart of America.
All
right
American
here in
Pelvic Health Summit.
And
right
here would be the perfect host for it, right?
Oh, I'd love to.
All right, bring it on, right?
Yes.
Bring all your pelvic floors to Effie Dam. Here we go. Anyway, Dr. April Ritz is in the house here. I put Ashley was on here, but she's sick today. Darn it.
Yes.
That happens.
Yes, this time of year is sickness going on all over the place. So
Yeah.
you stay over there. I'll stay over here.
I'm feeling great.
I haven't been
feeling
sick
good.
in 2 years, so let's keep it going, okay?
Very
All right, so
good.
what's going on here, Dr. April Ritz, in your fine black shirt that says your name and your business,
Oh.
in case I have a senior moment and forget.
Yeah, you can't forget. Here you go.
There it is. Anyway, how's it going? You guys doing okay?
Yeah, we're doing great. I am full patient load today, so sorry I was running in
That's
right
okay.
on time today.
We had 8 seconds, and that was all we
Perfect
needed.
timing. Hit all those stoplights just right.
That's right.
Always. Hey, so what's happening? Well, I know we're going to
yes.
talk about a few things, but what's going on with
So
you?
today I really want to talk about a topic we haven't really discussed on air, but what our community needs to know about pelvic rehab after abdominal and pelvic surgeries. It's not really talked about, but every week there are women and men in our community having these surgeries, and they do not know that there's rehab that they should be doing because they're not being told.
All right.
So-
What kind of surgeries are we talking about
Yeah.
that, like the normal ones? Which ones are we talking about?
Yeah, so if we think about abdominal surgeries, it could be hernia repairs, it could be C-sections, it could be colorectal surgeries, it could also be like endometriosis surgeries, depending on the approach, hysterectomies, prolapse repairs, anything. We have men too who've had some major intestinal surgeries, or if you have a significant heart surgery where they're actually cutting down into like lower.
Oh, sure, yeah.
All of that is going to impair our core diaphragm, and it can also impair our pelvic floor. So, if you have a knee surgery, nobody's going to tell you to skip rehab.
True.
Everybody's being referred after a total knee replacement to do rehab because your quad gets weak, your calf on that side is going to get weak, your hip's going to get weak. But yet people every single day are having these surgeries, and they're just told, okay, surgery's done, great, you're
All right,
good
off you
to
go.
go. Yes. And that's not the way it should be. So research is showing the benefit of rehab after these surgeries, especially like with hernia repairs. It helps reduce reoccurrence rate, but yet it takes 17 years for research actually brought into medical practice. So thankfully you guys give me the opportunity to come on the radio and talk about it, and so we can hopefully reduce that 17-year of gap of medical research being brought into actual practice. But I just wish everybody knew that after these surgeries, you really should be doing rehab.
Okay. So if you're, what kind of rehab are we looking at for like maybe a hernia or some of the more common surgeries you were talking about?
Yeah. So for hernia, there's different types of hernias. There can be inguinal, there can be umbilical, there can be incisional hernias, like after surgery, and then you end up getting a hernia through that tissue that was weakened. So what we're doing, the surgery itself, and depending on the type of repair, whether it's a mesh or whatever they're doing, it's reinforcing the defect. It's closing up that gap, but often there is still why do we have a hernia in the first place? It's typically because of poor core coordination, and there's a weakness in the core somewhere, and then that area that's weak is where that hernia is being pushed through.
Gotcha.
So they can do mesh and do surgery and fix that up, but we need to work on the core and getting the full strength back to where it should be. Also working on scar mobility. So often with these surgeries, we're getting scars. Thankfully, nowadays, there's a lot more laparoscopic surgeries with smaller incisions. But we see some pretty significant scars that are restricted. So when we palpate them, the fascia doesn't move equally in all directions. And then there's often tenderness or pain on one side versus the other.
Okay.
Wow.
So, when you have a surgery like this, how long, because there's a certain amount of recovery and stuff, how long should you recover before you start hopping on some rehab on that?
A great question. So it depends on what surgery we're talking about. But honestly, after C-sections, we like to get moms in within 2 weeks after a C-section. But then other surgeries, depending on what it is, like if it's a hernia repair, or let's say it's an oncology surgery for colorectal cancer or
Okay.
something,
Yeah.
we're going to look more at closer to the 4 to 6 weeks
Okay.
post-op. But there's always things that we can be doing at 2 weeks regarding the diaphragm, getting it to open and the core to start engaging. We are not touching scars though, typically until about 6 week period before we start working on fascial mobility. And then sometimes too, it depends on surgical protocols. But most of the doctors, we have a patient that's having another endometriosis surgery coming up, and we're going to be seeing her at 4 weeks post-op.
Well, very interesting.
That's the one of some of the surgeries you mentioned that could occur with this. That's the one I know the least about. I don't know too much about endometriosis, but it sounds like it's a pretty big candidate for rehab on that.
Yeah, so for endometriosis, that is a condition that happens in women.
Mhm.
And everybody who has endometriosis should have a pelvic PT provider on their rehab team. Some of our patients don't need surgery and they can manage their symptoms, and some of ours become completely pain-free with just rehab.
Oh, very good.
But then some of our patients need excision surgery, and so we have some doctors over in St. Louis. I have one that's actually flying out to Colorado in a couple weeks for this surgery. But with that, they are going in and they're removing the lesions that are internal in the abdomen. So we can't fix that with therapy.
Sure, yeah.
We can't take those lesions out. But often, because of this, endometriosis is a very painful condition, and our body learns to guard. So our abdominals become very tight and guarded. Our pelvic floor muscles become tight and guarded. And depending on where the lesions are attached, it can affect the bowel, it can affect the diaphragm. So we're working on rehabbing the musculoskeletal component of it, and then the doctor does the surgery to remove the actual lesions.
Interesting.
Wow.
Yes.
Takes a team to get through something.
Good.
I know some people that have had endometriosis, and it is
Yes.
not a pleasant
Yeah,
experience.
and up to 60% of those people with endometriosis, even after surgery, continue to have pain because they're not addressing the musculoskeletal, the guarding, the trigger points, and the muscles.
Wow.
And we often see pelvic floor dysfunction with these patients.
And I guess you've had some pretty good success in that, because that's a major thing, that endometriosis.
Yes, I love treating endo because people often are like, I've never heard of pelvic floor therapy for this. Like, what are you guys going to do? And I'm like, every single person with this needs a therapist on their team.
Well, that's awesome. Very good. So if you've got that or any of these other things, you might want to look into this as quickly as you can and get that team going, right?
Yes. I also want to hit on after colon or reproductive cancer surgeries. So I do want to partner more with our cancer centers and just letting the doctors know, because often they do the scary job of working with the cancer, getting the cancer out of the body, doing the chemo, the radiation. But then often these patients are like, hey, your cancer's gone, you're good to go. But then these patients are left with underlying pelvic floor, bladder, bowel dysfunction, sexual dysfunction. So radiation increases fibrosis, fibrosis is like an internal scar that can become really tight, and that tissue becomes tight and cause pulling in other areas. So up to 90% of gynecological cancer survivors, so whether that is uterine cancer, ovarian cancer, up to 90% of them are going to have sexual dysfunction.
Okay.
So often this is pain with sexual issues, and so we can really help with that and reducing the risk of that fibrosis and helping those tissues heal. And we've had patients with colostomy bags who've had their rectums removed, and sometimes some of those issues can cause pain down in that area from the radiation, and they're just told, hey, your cancer's gone, you're good to go. But then there's this underlying issue that, yes, isn't as severe as the cancer, but now they're having to live with these secondary effects, and they can be helped.
The first step is, fix the life-threatening thing,
Yeah.
but then let's fix it and make you feel better.
Yes, and some of these people are having bowel leakage issues too afterwards, and we don't want that. So
No.
It's a perfect tie-in because we just had HSHS in this morning because it's dealing with upcoming, colorectal awareness month.
Oh, that's
So
right.
It's more common than you think. Lots of us have family history with that, and then surgeries are a big part for some people.
yes.
Right on. Yeah, good
Said it
tie-in.
all. Okay, hysterectomies as well. After that's a pretty major surgery as well. What do you recommend on something like after a hysterectomy?
Yeah, so 1 in 3 women will have a hysterectomy. Research is showing by the age of 60, and up to 20% of them are going to have persistent pelvic pain after the hysterectomy. A lot of women have hysterectomy and they're feeling great afterwards. But I still recommend, even if it's just a few sessions of pelvic rehab after having that, because taking out the uterus, you are losing the uterus. Connects to our ligaments, which connects
Okay.
to our back, our sacrum. So taking out that uterus, then we have ligaments and tissue that is just there now.
Yeah, there's an empty space.
Yes. So rehabbing everything, the core as well as the pelvic floor, and making sure everything's in good balance. We don't want women after hysterectomy now having pelvic pain, now having urinary leakage or leakage with sneezing and coughing.
Oh yeah.
So after hysterectomy, again, we would say about that 6 week after surgery, and we will look at the pelvic floor load, how they're managing pressure in their abdomen, core strength, hip strength, and pelvic floor function.
Is it ever too late to come in for it? Maybe you're just now hearing about this and you had a hysterectomy maybe 10 years ago and you're just like, oh man, maybe I should have done that. I wouldn't be having these underlying things.
Mm.
Is it ever too late, or
It's
you can
never,
jump on it?
It is never too late. Muscles can always be rehabbed. They're going to respond quickest and best when you're younger and the sooner after surgery. But if it is 30 years, 40 years down the road, you can still rehab those muscles and still get function back.
Awesome.
Wow.
Yes.
Lots to do.
Very good to hear, as a matter of fact.
Yeah.
So there are people out there listening to this. Maybe you know they probably, a lot of people out there really enjoy your talks. I do believe they've learned a lot here in the last few years doing this, and it's so glad that you're getting people to come in and say, I don't know if I should talk about this, and then it's
Yeah.
like there's nothing we can't talk about, right?
I have moms I've been seeing for 2 years, and I had one today that twice, and she goes, April, this might be TMI. And I'm like, you have been working with me for 2 years. You know nothing is TMI. Please tell me.
No such thing as TMI.
Please tell me.
When it
Like-
comes to health, there's no TMI.
Right.
Yeah, my biggest thing is just like, after a knee surgery, people are not skipping rehab. Why are we missing this for abdominal and pelvic surgeries?
Absolutely.
Yeah.
Well, if you're hearing this and you're thinking, well, I probably should get in touch with Dr. April or somebody else at the F&M Pelvic Health and Wellness, how do they go about doing that?
Easiest way is to give our office a call. You do not need a referral. Our number is 217-705-5077. I encourage you guys to follow us on Facebook, Instagram, and we do have a YouTube account as well.
Oh, nice.
And then we do have another perimenopause and menopause class coming
Aha.
up March 16th. That will be at our clinic in Effingham as
Ooh.
well as virtual.
All right. And So
Wow.
if you want that, you can sign up for all those classes. You got them all
Yep.
listed on your sites, and that's a good thing.
hmm
All right. Very good. So you're a busy girl. You got to get back at it, don't you?
I do.
Get patients to see.
Sure, you're going to have time for lunch, though.
I am going to have time for lunch.
Okay.
Yes.
Very good.
Yes.
That's good to hear. But you got to take care of yourself, right?
Of course.
All right. Well, always a pleasure. You have a wonderful day, and we'll talk to you again soon.
Thank you.